Okay, welcome everyone, and welcome to the webinar today, which is Brexit Testing and Claims Compliance Implications. So I'm joined today by Thomas, who heads up our German operation. So we've got a bit of two sides here. We've got Thomas, who's still in the EU, and obviously me from the UK, and we've just left. So we're going to look at just the testing and claims sort of side of Brexit. There's a lot of information going on, and there hasn't been too many changes necessarily yet, but we're expecting a lot. So we're going to talk about where those changes might be coming in and what our recommendations are as well. So this webinar is being recorded. So I'll be sending out the recording afterwards if anyone needs to dip out at all. And there will be a chance for a Q&A at the end. So if you've got any questions, please feel free to put them in the Q&A box, and we'll be happy to answer those towards the end. So just look at the agenda today. We're going to be talking about the EU and UK advertising regulations, because this is where we're going to be looking at our claims compliance and if there's anything we need to think about in terms of that. We're going to look at the responsible person, because that is another thing that's changed slightly in regulation. Anything we've got so far in import and export regulations. And then we're also going to be looking at how we get our claims substantiated and how we can start thinking about that in the kind of Brexit format. So we'll be looking at a summary of consumer research, choosing the appropriate study design and methodology. And we've got a lovely case study with Thomas, who's going to go through some of that as well. So Thomas, please feel free to introduce yourself.
Thank you, Carys. Yeah, as Carey already said, I'm Thomas Marquardt. I'm heading the German business of Ayton Global Research. I've been a market researcher all my professional life, long time with Unilever, where I did all kinds of studies and in the end had an international role, a global role, which in a way prepared me for looking at different countries, different perspectives, different cultures, and differences between countries and different cultures. And of course, with some awe, I was looking at what's happening around Brexit, because I'm not only working with Carys and her team, but also with other people in the UK. And seeing how this is moving apart is not making me happy. But anyway, this is done. We just have to deal with the consequences. As I said, I'm a professional market researcher. I love market research, and I'm happy to be here with you to tell you a little bit more about our experiences.
Great, thank you, Thomas. And for those of you who don't know me, I'm the Regulatory Director at Ayton Global Research. So I've been here about 8 years now, and I've kind of worked my way through study management and running studies. And by understanding how studies are designed, I've got a real interest in regulation and how that kind of impacts on how things are designed, really. So obviously Brexit's really important for us, because there may be changes in regulations and legislation in both the UK and the EU, which are going to impact how we run our studies. We are completely global, so it's always really important to make sure we're up to date with these kinds of things. So yeah, this is where I kind of have my speciality, and if you ever got any questions about the regulation, I will certainly try and help where I can. It's mainly going to be focused around advertising regulation, in terms of people doing claims compliance, or to do with any testing regulations. So just to kind of introduce us to the topic, I want to talk about the cosmetics market within Europe. So obviously for people that are either in Europe right now kind of selling products, or in the UK, it's really important to think about what your markets are. And so there's a couple of excerpts here from some kind of articles which I thought were really helpful. One's to talk about where the largest markets are. And as you can see, UK is very much on there. So Europe is still part of Europe, even though it's not part of the EU. And Germany, France, the UK and Italy are certainly at the top there. So really important to think about that when you're thinking about your testing. Where do you want to target these markets? And maybe it's in the kind of biggest markets for cosmetics. There's also been an increasing demand on things like natural ingredients. So this is kind of trend throughout Europe. So obviously, if you're thinking about making products as well, this might be where you're thinking about putting your claims, but also thinking about how you're developing your products. So I always like to give a little bit of a key there in terms of where the market's going as well.
Yeah, that's just a little bit to illustrate the pure sizes of the market. As Carol already mentioned, it's about an 80 billion market. The biggest market is Germany, followed by France, UK, and Italy. So UK and Italy about the same size. But then it becomes fairly small after a while. So the number of countries that I haven't pointed out here, but you clearly see that UK is still a substantial part of the European market, even if not of the EU market. But there are some other players who are about the same size or slightly bigger.
And I also want to talk about the impact of COVID-19 on the market. I think it's a really important thing for us to think about. I think none of us really thought that in a year's time we'd still be in lockdown and having to deal with this, but of course it really is the reality of the situation. So while things are looking better this year with things like vaccinations coming out, it is really important for us to think about how the market is impacted, because of course you want to be educated around what you're selling. So there's kind of some positive sides as well. So that's why I wanted to bring out these kinds of excerpts. So there has actually been a real boom in certain industries within cosmetics. So certainly we've got candles, aromatherapy, detox products, anything that people want to self-care. It's a really stressful time. People want to stay at home and really pamper themselves. So it's kind of a really good way to think about your claims again, your product development, thinking about those kinds of aspects. Why do people want to use your products at the moment? It's not quite the same as it was a couple of years ago where it was to get dolled up and go out. It is more about that kind of self-care and that self-wellness. So also there's been some kind of changes in the way consumers are thinking about products as well. And certainly there's been a heightened appeal for local products, which is really interesting. I know I've certainly noticed it around my local area. We've all been pushing to sort of go for your local, butchers, greengrocers, and very much the same. It might be with your local market for cosmetics and things like that, simply because they are the ones that are suffering. These are the businesses that are closing down. So the more we can do to keep that up now, A, the better our economy is going to be, but B, it's all going to be there for us when things do hopefully at some point return to normal.
Yeah, and I think you also see a bit of the downside of globalization that many people see this as a global development, which is not very positive. So there's a kind of tendency of a bit cocooning and going back to your local surroundings and your local environment rather than looking at things coming from China.
Absolutely, yes, definitely. I think there's been a huge appeal for that. And again, that kind of idea of economy as well. People are very protective over their own local economy. But the other thing to think about with that as well is, just because people want local products doesn't mean you shouldn't be selling online and things like that and thinking about those other markets. So this is where we really need to think about ad self-regulation. So just because we've got maybe local interest, most of the time we're selling online now. This has become a really common thing for companies that maybe we're selling more bricks and mortar. They haven't got that option anymore. And it means you're really exposed, I guess, to more advertising compliance, simply because you've got more countries you're entering into or more countries you're displaying your adverts. And you really need to think about how they are being regulated. So ad self-regulation is the way for the industry to regulate itself. So basically we have different self-regulatory organizations in different countries. It's kind of done by a country basis. That are going to be responsible for looking after the adverts that are shown in those countries. It's mainly dealt with on a complaints basis. So this could be your consumers or it could be your competitors. With your consumers, they might receive your product, see all the lovely claims you've got on there, but find they don't have that experience when they're using it. So they'll put in a complaint about your product. It might be that your competitor sees your claims out on the market and questions whether you were able to achieve those claims. Maybe they haven't achieved them. Maybe they're just a bit jealous. Anyway, they do tend to complain about your products as well. Once that complaint's gone in, the self-regulatory organization in that country will ask you for your evidence behind those claims. So this is where it's really important to think about this from the kind of beginning. There's going to be other codes of conduct as well from country to country. So it's really important to be aware of what those are and make sure you're abiding by them. And there's kind of three parts of the industry that need to be aware of this. It's the advertisers who pay for the advertising agency is responsible for its form and content, and the media that carry it. So if you're kind of the part of that industry, you need to be really aware of what the advertising codes are in the countries that you're selling the product. A couple of little helpful links there. There's the International Chamber of Commerce. So they've got a regulatory framework which countries can adopt. It's about 52 countries that adopt that at the moment. So it's a really good starting place to see what that looks like and who's adopting it. And there's also the International Council of Ad Self-Regulation, or ICAS. And they're basically a kind of group of different self-regulatory organizations across the world that have kind of come together and they share news and things like that. And again, they have a kind of global database. So if you're not really sure, it's a really good starting point to think about who's regulating those adverts. There is the European Advertising Standards Alliance. We are still part of that in the UK. That hasn't changed because it's for Europe and not the EU. So they are an alliance of these SROs as well. I've selected a few countries here that are part of the EASA, so you can sort of have a look at who those might be, but it is most countries in Europe. So in the UK, you've got the ASA. In France, you've got the ARPP. In Germany, you've got the DWR. In Italy, you've got the IAP. And in Russia, you have the RSR. Russia's an interesting one, and I wanted to bring them up because they're an observer of the EASA. So that kind of means they're kind of looking at what the EASA are doing, but not necessarily following them all the rules. So you do need to look at them specifically as well. Whereas the other countries are very much going by the same code of conduct and kind of having that real shared experience. So kind of just bring those kind of those definitive organizations out, so you can have a look at their websites, and if you're selling there, and have a think about what you're complying with, really. There's also going to be different advertising laws. So there might be countries in Europe and the EU that aren't part of the EASA, that don't even have their own SRO. So, you kind of think, well, they have a code of conduct, I can just say what I want about my claims. Not necessarily. There is also going to be advertising laws, and this is the case in any country across the globe. So I've kind of brought out a couple of those to make you sort of put your attention in that direction as well. So in Croatia, they've got the Electronic Media Act. So that's any misleading advertising in the media. So if you've got any claims in the media, that's the act that you'll be looking at. The EU approach to advertising has been adopted by Romanian law. So again, if there's any EU advertising laws, that's where Romania kind of getting theirs from. And Malta have got the Consumer Affairs Authority. So anything to do with advertising in Malta is looked at by them. So always be aware of the laws as well as the self-regulatory organizations. Kind of other organizations to think about with advertising as well, mainly for information. We've got the Advertising Information Group. And again, so this isn't thinking about EU and UK. These are the countries that are still working together and being a part of this information group. So you've got Germany, you've got Austria, and you've got the UK, as well as other members, but they're kind of the main ones. And they put out lots of information about advertising compliance. So really worth looking at, again, because if anything changes between the UK and those other countries, it's going to be put on there. So you can keep an eye on that as well.
If we talk about European bodies, it's worth mentioning Cosmetics Europe, who is actually the leading European trade association for the cosmetics and personal care industry. So quite a few of industry and trade partners are part of this. They provide useful information for the industry, including they also have strong guidelines for cosmetic claim substantiation. So lots of these requirements that are there for claim validation you find in these guidelines. At any rate, they have lots of useful links wherever you look for information. You find it on the link we've mentioned on the bottom, and just on the right, just for an example, is actually how they also match and map the market in terms of 7 key categories and subcategories, which also I think is quite a useful segmentation for people who are entering the market. So whenever you look at starting to get more knowledge about the cosmetics industry, the cosmetics markets, they are a very useful point to start at.
Absolutely. And there's a similar organization which are very specific to the UK, which is the CTPA, Cosmetics, Toiletries and Perfumery Association. Now, they've always been a UK organization, but it's been in the past very much EU law. So it was quite mixed together. Whereas now they're putting out really helpful information, which is specific to the UK and the UK regulations. They also have information specifically on cosmetic claims, and they've got the Guide to Advertising Claims and the Confidence in Claims booklets. So really worth looking at that and becoming a member if you aren't already. There's also the European Commission. So we're thinking about EU regulations for cosmetics specifically, and this really is the EU one now. So this is where we have real separation happening. So they've got a regulation which is specifically on cosmetic products. It's the main regulatory framework. It basically means that you've got all of the safety for the cosmetics is strengthened to make sure that we aren't putting out any unsafe cosmetics. But they do also have regulations there about things like claim substantiation. So it's really important to look at the EU Commission, the regulation there. But now we also have a UK cosmetic regulation. So at the moment, this is an exact replica, so nothing to panic about too much. But the point is there are now 2 separate regulations and things could change. So it's quite simply called the UK Cosmetics Regulation. And it's found within, the Schedule 34 of the Product Safety and Metrology. It's a lovely tongue twister for me there. But that's where the UK regulation is for cosmetics. So that's now come into force, and it's applicable in England, Wales and Scotland. Northern Ireland is now EU regulations, but there's going to be some other regulations there. I think Northern Ireland will be tricky for anyone trying to navigate that industry at this kind of crossover point. But like I said, at the moment, this is very much a replica. There's nothing different between the EU and the UK, but do be aware to keep an eye on it in case anything does change. We are fully entitled to start changing that now if we wanted to. So there's a couple of links at the bottom there, which are really helpful to get some more information on that. There's also going to be some changes to import and export, and I think we've already started to see some issues. I know there have been lots of lorries stuck at the borders between France and the UK and things like this, and lots of complications. I've had it myself. I had to send a packet and I had a box given to me with the labels, and then I couldn't use that one, and it was a whole thing for like an item return. So yeah, it's certainly started to have an effect that we can all start to see. So there is a new, basically, free trade agreement. So it was in the single market. There's now a free trade agreement. So there are some different rules that are now put into this. And one of them is the rules of origin, which is set out by the Trade and Cooperation Agreement. So it's basically looking at the origin of the products, but also the materials that are used within the products. So really specifically for the UK, we need to think about where everything in that cosmetic has come from. This is basically to make sure that the kind of really beneficial trade agreement that the UK now has with the EU is only given to the UK and not to other third countries. So it does get a little bit tricky now because, as we know, with cosmetics, you might have lots of ingredients coming from lots of different places. It's to do with the majority of where it's come from and also where the product is produced as well. But if you haven't heard of it yet, please do have a look into that, because it is going to really, really affect import and export if you've got a cosmetic from the UK going into the EU. What impact does this have on testing in particular for us? Right now, we do need to have some more information if we are looking at a UK product going into the EU. If you're doing a test with Thomas, you're based in the EU and you're doing an EU test, you don't have to worry about this so much. This is really specific for UK to EU. And it might be the case as well if you are an international client who's using our UK head office to place studies again in the EU. We need to start thinking about this. So I've put a list here of things that we need. We don't need all of these, we need one of these, so don't panic. So we either need a commercial invoice, a certificate of origin, the costing bill of materials, or an origin declaration. So we would very much need one of those if we're putting something into the EU. At the moment, our advice has been given to us by our specialists that any products that are manufactured in the UK state UK for the purpose of the consumer study. So we need to think about that again right now. So yeah, if you've got any kind of studies coming up that are going into the EU, even make sure you've got one of those documents. And if you do, really think about where the country of origin is. We don't want to overcomplicate this study. So this is the advice we've been given so far. Again, this might be subject to change, but hopefully that's kind of gives you a starting point. So another really big part of the regulation which has changed, which I kind of touched on earlier, is this idea of responsible person. This has always been a thing, as you'll know, if you have ever sold cosmetics in the UK or EU before, you are still, you would have had a responsible person. And I'm sure many of you have already been through this process where you have to now have both a UK and EU responsible person. So it means that you need to have the labeling reflected as well. So if you're selling the product in the UK, you need to have the labeling to correspond with the UK RP. If you're doing it in the EU, very much the other way around. Really interesting information I came across here, which is saying that Irish entities sourcing cosmetics from the UK to supply to the EU may become an importer and potentially the RP for the product as well, if there isn't already one designated. So that's a huge part of regulation, which could get people into trouble, kind of, not expecting to be, if you're just a distributor who's looking to distribute products between the two kind of territories. So really important to think about that. The most important thing that I want to talk about with claims with a responsible person is that your claims may come under further scrutiny. I saw a lot of this last year where people either had a UK or an EU responsible person, and they were approaching a new one, and actually they found that they might have had an internal responsible person who was kind of slipping products through with their claims, sort of signing them off saying, yeah, happy with the evidence. But actually by approaching a new company, they said this evidence isn't suitable for these claims. So now we're doing a whole backlog of studies to make sure they can continue to sell them. So when I say things might come under further scrutiny, we are really here to help with this kind of thing. If you do have a concern, if you're RPs respects concerns, or you haven't even approached an RP yet and you're concerned about your claims compliance, please do come to us, and we're really happy to provide a free gap analysis on that and see what your evidence is, and then we can look at providing further evidence if you do need it. So what kind of evidence do you need? Talking about kind of how we can help you. So there's different types of ways you collect evidence for claims. The main thing, well, the thing that we do is consumer research. So obviously we'll talk specifically about that today. So consumer research as a whole tends to be in-use tests or in-home user studies. So quite simply, we send products for people to test at home, and then they fill out questionnaires about their perception of the product. So they tend to be self-assessed claims. They reflect the actual conditions of the product in use. So even if you have other evidence available, so for example, clinical evidence on ingredient claims, this won't be sufficient. So you need to have actual evidence from people using it as they would when they purchase your product to substantiate your claims further. They could be looking at the efficacy of one product. They could be comparing other products. It really depends on what you're looking to investigate and the kind of claims you're looking for as well. We can also gather information about undesirable events in the actual use conditions. So obviously you might have a safety test about your product, but really we want to make sure that, you know, on a large scale, when 100 people are sent these products to test at home, are there any undesirable events that haven't been considered? There may be some additional evidence you need in terms of instrumental studies. And again, we're really happy to provide evidence and provide help on this and advice. Again, if you send over claims, we can always say where further evidence is needed, and we have partners that can help us with that as well. So why else would you conduct consumer research, as well as to get that really important claim substantiation? I really like to talk about this because I think there's so much more to doing a consumer study that you get out of it, maybe compared to doing an instrumental study. So for the first thing is you can get all of your claims substantiated. We can get all of the participants to look at everything they can self-assess, and they can all be done in one study instead of lots of different instrumental studies that you might get through doing clinical. But also you can look at getting other feedback, which is really important for your marketing and your product development. So things like product and brand perceptions, you know, would they pay this price for this product? Did they like the packaging? Did they like the branding? We have to do the study unbranded, but there's no reason why after they've answered those efficacy questions, you can't then ask them these questions about your branding. You can look at benchmark testing against your competitors, or maybe testing an old and a new formulation and seeing which one is the winner. Really important if you're looking at changing supplier at all. And certainly if one of those suppliers at the moment is EU or UK and you need to get a product manufacturer in either one, you would really want to look at how those formulations are comparing. Investigating new markets, again, maybe you're looking at going to an EU market where before you were just UK, or, you know, making sure that you've got reflection from both the UK and EU market. And you can gather other kind of marketing material like testimonials and reviews and photos and videos. There's some examples of some claims you might find with consumer research as well, just to give you an idea of how you might quote that in your marketing. So what kind of advertising claims will you see? Sorry, sorry about that. So on online, you might see the advertising claims displayed in this way. So here's some brands that I've picked up on their website and how they've got their claims displayed there. And these are all conducted through consumer research. So Elemis have got some amazing 100% claims there. Things about the appearance of wrinkles, the skin feeling deeply hydrated, the appearance of expression lines being reduced, all these lovely anti-aging claims. Philip Kingsley have got some lovely claims about their hair care product, which helps with a scalp. And again, you can see how high those percentages are and how that would really help elevate their marketing. And obviously, Charlotte Tilbury have also got some fantastic claims there as well from their consumer research study. So we always think about the compliance side of claims, but we also really want to think about how that's going to elevate your marketing. So don't go, okay, well, I've got to do claims now that are compliant in the UK and EU. I'd rather not say any, because obviously this is what people are seeing when they're purchasing your products. And if you're comparing against these competitors, they'll definitely choose the ones that have got these amazing claims about their products.
Because when I see these 100% claims, I'm always a bit skeptical about their research, because you hardly ever achieve 100%. Products can't be that good. There are always some skeptical people if you are serious about representative sample of people. So.
Absolutely, these are very, very high claims, but I haven't come across the older 100%, definitely.
The odds, but I think it's in this kind of things I wonder actually who they have asked. So 100% of the employees have agreed.
Absolutely. Well, that's a huge thing, and that's why we have to do independent research. So to go back on the slide there, oh, I can't go back actually. Oh, let's try that again. Oh, Thomas, can you go back at all? Oh, it's gone now. That's there. Sorry, oh, that's the one. So from Philip Kingsley's one, if you go back again, sorry.
This one? Yep.
This is the one. You can see that it says 95-person independent consumer perception trial. So this is where you can really look at that evidence and where it's come from. And this is what's really important in terms of compliance, as Thomas says. If you've got internal research, you can't use that for your advertising claims in any kind of format, because it would be incredibly biased. However, when an independent consumer perception trial, we know that we've got independent volunteers. It's not relevant to the company who is looking at getting it, not the brands that are looking to get the claims. It would be someone like us, essentially, who would get those claims for you. So this is a really good thing to look at in marketing, even on a consumer point of view. If you're a consumer, it's really good to look for that independent evidence as well. So we've also got claims on television. So certainly in the UK, we've got Clearcast, who will look at your claims and make sure they're going to be applicable to use on television. And you would see these kind of claims across the sort of lower third of the TV, which basically whatever claims they're talking about, they say what percentage of how many people agreed. And you need that to advertise on television as well. So it's a really important thing to think about. And obviously social media is probably our number one growing thing for selling products and marketing. Certainly with the introduction of TikTok we saw last year, we're seeing a lot of people look to social media to see what kind of products they want to purchase. So what can really elevate that is your consumer research again. So Augustina Spader, I always find it really hard to say that, I don't know if I've said that right, have got some really good results from their consumer study there. And LMS have also got some lovely percentage agreed quotes in their advertising. So now Thomas is going to take us through a really good case study to look at how we actually get that evidence.
Yeah, actually, so this was one of the most interesting studies we had last year, if not definitely one of the most challenging study, because we had to test the perinatal spray, and quite frankly, I learned a lot about categories and products that I've never used and I never thought of before. So this is always also an ongoing learning experience. So we had a leading UK manufacturer who came with this perinatal spray and wanted to prove the product's efficacy and substantiate some claims. And they decided to test this not only in the UK, but also in Germany. That's why I also was part of that wonderful study. It was obviously in English and German. And the challenge was to find women who are pregnant and will give birth in the next months, and will be willing to test a product around 1 or 2 weeks, starting 1 week before giving birth and until 1 week later. So in this very interesting and very exciting and very laborious and very difficult times, they were actually willing to test a product and give feedback after that. So it was a bit challenging to find all these women, but we did. And apart from that, actually we had a split of first-time moms and repeat moms between 20 and 40, and of course also they should have at least some money available to buy these kind of products. So we tested this. Apart from that, of course, the other logistical challenge was that, of course, normally you can say everybody tests a shampoo at the same time for 2 weeks. Obviously, you can't time exactly the date of birth. so we had stretched it over a couple of weeks so that we could make sure that people could really give birth, because this is obviously not often on a planned date. So we had several batches of products sending out and several timings when the feedback came in. But it worked. It was quite an interesting study. We share some of the results. If you've followed our webinars before, you see that kind of screen, which is a kind of typical visualization that you find in our reports. You see that we had 100 respondents, exactly 100, which doesn't make it difficult to calculate percentages. First on the left-hand side, first you see the numbers who were satisfied, those who were neutral and who were not satisfied, and then the same as percentages. And you see an asterisk in the satisfied when they had actually crossed the border of what they said 2/3 of the respondents should agree to that statement to have the claim validated. And you see that the number of claims, like the spray is easy to use, the spray feels instantly soothing, the product feels cool and fresh, this is essential for any expectant mom's hospital bag. All these claims definitely were beyond these 67%, but a claim like this product helped me to quickly feel like me again after giving birth. This is actually obviously going a bit too far, and people and women or the mother said, well, this is actually asking too much of the product, so it needs a bit more to make me feel like me again. This is what the product cannot deliver. So this is a claim that the company would have liked to use, but a claim is not validated, so they shouldn't actually use in communication. But what's interesting is actually, as we had the study in 2 countries, it's also worth looking at the results by country, which I also did on the next page, where I show that there's the same totals again, and I look at the countries, the result by country in UK and Germany. You see the spray is easy to use with a claim that was loved and validated everywhere, but the spray feels instantly soothing is actually something that's was very high in the UK, but not so much in Germany. So if you had only tested it in Germany, you wouldn't actually be able to use this claim in Germany. The product feels cool and fresh is validated everywhere. This is essential for any expectant mom's hospital bag, just about met the deadline or the benchmark in Germany. And you see the product helped me to quickly feel like me again after giving birth, had almost met the benchmark in the UK, so very close to it, but not even half of the women in Germany agreed to that statement. So, well, Germans tend to be a bit more skeptical. This may be a reflection of this, but I think this is the moment where it becomes interesting for market researchers. And if we have the time, if we want to go deeper into the data, you can check on different hypotheses why this could be the case. So one reason might be that there are different health systems. So people react differently or are treated differently in hospitals or wherever they give birth. There might also be different ways to give birth. For instance, we had quite a few people, women who had a cesarean, and the percentage was different in Germany than it was in the UK. So you might, for instance, look at people who have a cesarean versus those who give birth another way. People might use product a different way. People might be used to different competitive sets. So maybe there's a competitor that is already delivering a lot in one country and not in the other. It might be in some cases a wording or translation issue, because we know that words also have a deep cultural meaning, and not everything can be easily translated. Always say actually phrasing it in other languages is not a translation issue, it's really a cultural transfer of meaning, which can be much more difficult. It can be random, a random effect, depending on the sample size. So with low sample sizes, chances are higher that you have a random effect over here. And there might be bigger cultural differences. Talking about sample size, by the way, the higher the sample size, the more likely you will also be able to look at difference, because you need to have a certain sample size also for subgroups to be able to compare them. So if you want to look, for instance, at people with a cesarean, it doesn't help you if you've got 3 or 8 or 10 women who had a cesarean. This is not enough to make a solid statement. After all, I'd normally say you should have 50 or at the absolute minimum 30 respondents in a subgroup to be able to look at the details. So a bigger sample size not only gives you more solidity and stability in your results, it also allows you to look deeper into the subgroups and do a more special and a deeper analysis of what's happening there, and explain these differences that occur. And they come up very often, and they sometimes leave you confused if you don't have a good hypothesis and a good explanation for these. talking about cultural difference, I wanted to give you guys one of my favorite examples in Europe, which goes back a long time, which is actually about religion. And funny as it seems, and even if most people in Europe are not really religious anymore, you still see this as a basis for many things that are different, because you really see that there's a difference in cultures between the more Protestant regions and the traditionally more Catholic regions. And especially when it comes to all kinds of indulgence products. And I think cosmetics often are also related to indulgence, but it's just also seen in food cultures where I work a lot, that you see in the Catholic regions are the ones who tend to be more indulgent. Very obvious at the border between Belgium and Netherlands, which is a border between Catholic and Protestant and Calvinist region. And everybody who's traveled this region will confirm that food in Belgium is definitely more luxurious and more indulgent than it is in the Netherlands. And it can be related back to the basics of Protestant of Catholicism, which is you can get absolved of your sins, whilst in Protestants you can't. So the only way to not to have a huge book at the final judgment day is not to commit sin. Indulgence is sin, so you're not sinning, so you're not indulging. And as simple as it may seem, it actually can explain a lot, and you see these differences coming up in many categories. But anyway, this is a bit of a digression, but I just wanted to flag the issue that think of cultures, and cultures do not necessarily stop at country borders. There might be different underlying things that go deeper than country differences, and these cultures are worth looking into. And if you have the feeling that there are different cultures reflecting on your product sales, test and check into different cultures, different countries, to validate or to find out these differences. Okay, so far for this.
Well, I was going to say, Thomas, it really reflects what we were saying earlier with the responsible person now being EU and UK. If they're aware of these really cultural issues, if you have a UK study, for example, and you're going to the EU, they might say that the evidence isn't substantial enough because they need to have EU people testing the product for the claims to be there, and very much vice versa. So that's why there's a really good example of the study, because we can do a study in both, and it really makes sure that you can make those claims, but also analyze which countries are actually looking at those claims. As you say, some might not pass in Germany. Can't use those claims in Germany for German mums. It wouldn't be fair. So we really need to look at, making sure the evidence is applicable for both. And that's what your responsible person would look at in both those territories.
Yeah, and by the way, indeed, there's a good point, Carys, to make. If you go back to these, by the way, also the questions for the choice of claims, all these first four claims are valid, and you could use them overall. But if you really want to make a choice, you better go for a claim that is also can be validated in each country individually. So this is a very good point, which helps you identify the right claims and the best claims to use in the end.
Oh, absolutely, yeah. Because you could ask 20 claims in your questionnaire anyway. You're not exactly going to use them all.
Yeah, exactly.
So yeah, exactly. That's a really good point. It's how you really select those claims as well. But again, I wanted to bring it back to the legislation, and this is from the EASA. And as we mentioned earlier, that is not affected by Brexit. It's very much a European organisation, and the UK and lots of European countries and EU countries are still a part of that. So what they're really saying about claims in particular is that advertisers should always have their evidence ready to be objectively judged. They always need to have their claims substantiated before putting their products out there, before putting those claims out there. Because if they do get a complaint about it, if you get a complaint about your product, you need to be able to provide that necessary evidence straight away without delay. So, we do, as I said, we might be backing up claims now. We're going to a different RP and finding that actually the evidence isn't supportive enough. But the important thing is you need to think about this before you get a complaint about your product, before you're approached with it, because otherwise you're going to be in real hot water, and essentially just have your adverts removed straight away. There could be bigger implications further on, but that's the first thing. And if you have claims on your labels of your products and the evidence isn't there, it could be a whole product recall, which obviously no one wants to go through. So also with the product information file, we needed to bring this up again, as we have in other webinars, because obviously all of your claims need to go in your product information file. So all of your evidence will go behind that, as well as obviously things like your cost listings and your adverse reactions. But yeah, your claims will do that as well. And we now have two different portals. You've got the EU Cosmetic Product Notification portal and the UK's new SCPN. So obviously, again, your claims are really being put out there a lot now. You've now got two different portals as two different kind of routes where your claims could be challenged. So always make sure you've got the evidence before registering your products as well. So we're going to do a Q&A in a second. I just want to do a couple of little FAQs and some information about us. So obviously we've told you about why you need to get your evidence behind your claims, but why should you use us in particular? So we're an award-winning research agency. We're completely compliant with the GDPR, and that means we also have an ISO 27001, which is where we get audited on that. So this is really, really important when we're looking at having data for our volunteers, but also data for you, all of your product information. We've got that undesirable event reporting, which I've mentioned, which is also in accordance with the Cosmetovigilance Act. We've got full product liability insurance in all the countries that we operate, which is really important to make sure that you have a provider that does have full product liability insurance. We've got an ISO 9001, which is all to do with our quality assurance. We are a partner to the Market Research Society. So again, we are judged quite thoroughly to make sure we're abiding by their code of conduct, which really looks at the best study design and questionnaire design, but also the fact that we're doing ethical research. We provide bespoke regulatory advice, which is what I can do. And again, please feel free to reach out to me at any time. And you also get a designated study manager who is your point of contact. You're not passed around lots of people, and they'll learn everything about you and how you need to operate, what your research objectives are, how you like to run studies, and we'll always carry those forward with you. And a couple of little FAQs. So as Thomas mentioned, we were looking about panel sizes. We always recommend starting a panel at 100 responses, but this could be kind of changed either way, depending on if you're looking at different countries, you're looking at different subgroups to investigate. We will always recommend on this, but it kind of gives you a starting point, because some people say, is 30 enough? Is 50 enough? Really, you want to be thinking about 100 from the get-go at the kind of least. You always need to let your product liability insurance provider know that you're using an external supplier for consumer studies. You need to ensure that all your samples have been safety tested. I always get the question, what kind of safety testing do I need? It depends on different products. So always have it in your mind that it needs to be safety tested or approved to the point that it could be released on the market. I mentioned earlier that we need to have debranded samples. This is really important for unbiased results. And actually, a lot of cosmetic regulations are putting it out there now that you can't use branded samples for claim substantiation. It's always been kind of a given, but it's getting really put out there in writing now. Your questionnaire design should always support your claims, and we can always give you advice on that, as well as any other professional advice that you would need from us. So we've got a summary first. I was going to go to question and answer. Thomas, would you like to summarize for us?
Yeah, fine. So you've seen that Brexit has a lot of implications on import, export, and labeling. It's a lot of practical things, like a responsible person that you definitely need for each territory. So you need two now. The use of claims is still mainly a country issue, which is coordinated by European associations, and we've seen that these associations are mainly European, not EU. So this is not changing automatically. For the time being, we do not see an immediate impact on claim validation. And as you've seen, for the time being, UK is replicating the EU norms. But this means they are replicating, and from now on, these paths can diverge. And we have no idea how far they will diverge, but they will not go hand in hand anymore. So we need to be aware of a potential divergence. Testing different countries broadens your perspective. You've seen it in the example that I've shared with you, and it can highlight potential differences and cultural difference. So independent of EU Brexit, the diversion, it's still useful to look at different countries, because it gives you a deeper perspective on how people think and how your product performed. That's why in the end, we give the recommendation to consider testing in the UK and the EU if you want to launch a new product in both territories, because it will probably make your life easier. Because as you've seen, it needs to be certified in two bodies, in the EU and the UK. and a certification. And we don't know in how far a UK test will always be applicable to the EU and vice versa. So to be on the safe side and to make sure that your claims can be validated and will be accepted, it's probably better to do the test in both regions from now on.
Absolutely. So
of course, that you want to launch in both regions.
Oh yeah, exactly. We don't want to launch in both regions. Still fine, but otherwise, please do. Yeah, so we'll open up to question and answer now. I've not any questions in yet, but please do feel free to type in any questions that you may have. And if there's too much pressure right now, because sometimes you can be put on the spot a bit, you can feel free to email us as well. So I'll send both mine and Thomas's contact information out with the recording just after this webinar today. So I'll give you guys a couple of minutes there, or a minute to see if anything comes in, and if not, we'll summarize the rest of the presentation. I always feel like there's a lot of information that we give out and everyone has to absorb it. I can't see anything coming in, so I am going to carry on. But if anything flags up, I'll stop, just so I don't hold everyone up for the day. So just wanted to point our attention to the next upcoming webinars that we have. So myself, I've got a webinar on the 5th and the 12th. One is for making effective and compliant advertising claims in South America specifically. And the other one is about substantiating claims for electrical products and tools. And then Thomas and I have got another couple of webinars towards the end of the month. So we're going to do a webinar just about panel sizes. So we've touched on that today. So we're going to really go into some detail on that. And we're also going to do one at the end of the month, which is for cosmetic trends for 2021. We'll be looking at some trends that are going to come up and how you can maybe substantiate some common claims with those products. I also want to put your attention to the SCS. So they've got their distance learning course and the essentials of cosmetic science, which can be done in your own time anywhere in the world. So if that's something you're interested in, please feel free to look at their website there. And we've also got the IFSCC Congress, which will be in London from the 19th to 22nd of September 2022. So fingers crossed that will happen in person, and you can register your interest there as well. So that is one of Thomas's contact information, but as I mentioned, I will be sending that out on an email. Thank you so much for joining me today, Thomas. I've really enjoyed it.
Thank you, Carys.
And thank you to everyone for joining us and watching. And yes, feel free to ask us any questions at any time, and have a great day.